In March this year, the world watched in anxiety as cases of the novel coronavirus outbreak started appearing in large numbers outside China, prompting the World Health Organization to officially declare it as a pandemic. This pressured several countries to impose travel bans, lockdowns, quarantine rules, and other preventative and proactive measures to help mitigate the transmission of the disease. In South Korea, widespread testing was aggressively implemented, revealing the number of confirmed cases to be in the thousands. As a result, this also led to very low mortality rate of below 1% in the country. Another country being praised for its quick response to the viral threat is Taiwan, being dubbed by many as the model for coronavirus response. Despite being in close proximity to China, the country managed to keep its cases under 135 since the outbreak due to imposing stringent measures as early as December last year. This included strategies such as sending their health workers on planes from Wuhan, China to assess if any passengers were displaying symptoms of the virus. Unfortunately, the number of cases in some countries have exploded to the point of overloading hospitals, with more than 47,000 confirmed cases. Italy is the #1 European country and second country in the world with the worst coronavirus outbreak outside China. The country is now on total lockdown, but the disease is still spreading fast. Just on Thursday, Italy announced 5,322 new cases and 427 deaths within just 24 hours. As of writing, the virus has spread to 158 countries and territories, including Spain, Iran, and the US, who, as of March 20th, have over 20,410 cases, 19,644 cases, and 19,101 confirmed cases of infection, respectively. Many celebrities and athletes have become part of the confirmed cases. Recently, actor Tom Hanks and his wife, Rita Wilson, announced that they were positive for COVID-19, as well as British actor Idris Elba. Utah Jazz players Rudy Gobert and Donovan Mitchell were also diagnosed with the virus just mid-March this year. Even politicians are not safe, such as UK Health Department Minister Nadine Dorries, Iranian Vice President Musammeh Ebtekar, Australian Home Affairs Minister Peter Dutton, Miami City Mayor Francis Suarez, and even Sophie Trudeau, wife of Canadian Prime Minister Justin Trudeau, who are now under quarantine trying to recover from the virus. The COVID-19 outbreak should not be downplayed. In fact, Dr. Michael Osterholm, an expert on infectious diseases epidemiology, says that this is only just the beginning of the outbreak, describing it further as at least 10 to 15 times worse than the worst seasonal flu year we see. This could very well mean that the outbreak can last for months and may resurface even after the numbers have subsided to almost nothing. To combat this virus, the most important thing to do is to first recognize it as a crisis. In the U.S., President Trump finally declared a national emergency over the coronavirus outbreak, which invokes the Stafford Act. This essentially opens more federal aid for states and localities, and as Trump stated in his announcement, would give access to up to $50 billion of funding to support the disaster relief response against the disease. But while governments are scrambling to find effective solutions to fight this pandemic, what are the things that we do to protect ourselves and help slow down the spread of this disease? First, let's understand how it can be transmitted. There is limited data on this new virus, but the Center of Disease and Control confirms that it is mainly spread through person to person in close proximity at around 6 feet. The virus is transferred through respiratory droplets, such as when a person sneezes or coughs, which may land in other people's noses or mouths or be inhaled into the lungs. It's also possible for the virus to spread by touching contaminated objects or surfaces, and then touching your eyes, mouth, and possibly even your nose. So what are the ways to interrupt its spread? You probably already know that hand washing is one of the best ways of getting rid of the virus. With just regular soap and water, you can effectively annihilate the coronavirus, keeping both you and the people around you safer. Of course, there is also the proper way to do it, using certain simple yet effective hand-washing techniques. But another very important rule is that you have to do it for at least 20 seconds. To ensure you hit the 20-second mark, you could sing the Happy Birthday song twice, but that can get boring fast. Instead, you can try singing this jingle. Wash hands, take a lot of soap and add some water. Wash hands, take a lot of soap and add some water. Get the back of your hands all around your fingers, lather up real nice, yeah, so no germs will linger. Wash hands, take a lot of soap and add some water. Wash hands, take a lot of soap and add some water. Wash hands, take a lot of soap and add some water. Get the back of your hands all around your fingers, lather up real nice, yeah, so no germs will linger. Wash hands, Take a lot of soap and add some water. If you can't immediately wash your hands, you can use an alcohol-based sanitizer that has at least 60% alcohol. According to the World Health Center, you don't have to wear a mask if you're healthy. However, if you choose to do so, you should know how to use it and discard it properly. Then pair it with proper hand hygiene. Especially if you're caring for an infected person or are among the frontliners in this pandemic, wearing a mask is one of the recommended preventative measures. Keep in mind that there may be a short supply of masks. It's better for a sick person or a healthcare provider to wear one than a healthy person, as this would be highly more effective in stopping others from also getting the virus. Since the disease is easily transmitted in a community, it is crucial to practice social distancing to lower the chances of exposure. Avoid close contact with people and maintain a distance of at least 3 feet or 1 meter between yourself and anyone who might be potentially sick. And most importantly, do not start hoarding supplies. Don't get crates of stuff or start emptying aisles, and then worse, take advantage of the situation by reselling supplies at ridiculous costs. What this situation calls for right now is empathy, sensitivity, and cooperation. And don't hoard, man. Due to a lot of misinformation circulating around and the fact that some of COVID-19 symptoms are like that of the flu, many people concluded that the two diseases should therefore be treated in the same way. However, the two are very much different. While flu symptoms may show almost immediately, COVID-19 symptoms are gradual and may take several days to worsen. According to the World Health Organization, the most common symptoms of the disease are fever, tiredness, and dry cough, with possible experiences of aches and pains, nasal congestion, runny nose, sore throat, and diarrhea. According to the CDC, the virus has an incubation period, or the period between exposure to the virus until display of symptoms, span from 2 days to 2 weeks. However, on February 22nd, a case had been reported in Hubei province with an incubation period reaching 27 days. There are also some people who become infected yet don't show symptoms. They're still highly infectious, they just have no idea that they're carriers of the virus, so don't risk it. You might come into contact with those who are at higher risk toward the disease, such as those immunocompromised or people with underlying chronic illnesses like diabetes, high blood pressure, and heart problems. Any one of us can be a carrier without our knowledge, so even if you feel perfectly fine, stay indoors as much as possible. You can rebook trips or go to events at a later time, but keep in mind that a life lost is forever. Seeing as that one of the worst things to be at right now is in crowded settings, you can understand how traveling increases the risk of exposure to COVID-19. As a result, many countries have issued travel bans in an attempt to contain the spread of the virus. Most European countries like the Czech Republic, Poland, Ukraine, and Asian countries like India, Japan, Myanmar, and Singapore have already imposed such stringent measures. And now that cases are also beginning to pop up in Africa, governments in Ghana, Kenya, Morocco, Namibia, and South Africa are announcing travel restrictions. In the US, President Trump issued a travel advisory that banned entry to foreign nationals from 26 Schengen countries, including Austria, Italy, France, Finland, Germany, and Spain, who have been to Europe within the past 2 weeks. Some countries have also imposed lockdowns and bans on large gatherings such as Italy, Denmark, France, and recently Spain. In the US, states like California, Indiana, Louisiana, and Massachusetts now have a ban on any and all events over 250 people. Even international and major public events got canceled, such as the NBA, MLB, Major League Soccer preseason games, and all Broadway shows. In these times of crisis, the key takeaway is that health is a public concern, and therefore every one of us has a responsibility in helping fight this disease. Especially with the stigma that has risen from the situation, the best way to fight it is through being aware on the happenings surrounding this pandemic and sharing the facts. Let's give each other support in any way we can, may it be donations or just like singing together from our balconies like the Italians. Not to mention, China is reportedly recovering and may be ready to bounce back soon. The country has been reportedly experiencing a decrease in the number of cases in many of its provinces. Out of the country's 81,250 cases, more than 71,266 have reportedly recovered. In fact, it's the first time ever since the outbreak that more coronavirus cases were confirmed outside of mainland China than inside. People are now looking towards a vaccine to put a major halt in the further spread of this disease, but it may take months before global immunization becomes feasible. But rest assured that scientists are working day and night to get results faster. As of now, about 35 companies and academic institutions are trying to achieve this, and in fact, human trials are reported to soon enter by April. As for now, the best you can do is to keep you, your loved ones, and possibly countless others safe by practicing all the mentioned preventative measures. Have a good day, and see you in the next video.